The term carer is a difficult one. Not many people consider themselves to be carers, but a carer, generally speaking, is anyone who looks after someone with myeloma. Now that could be physically, psychologically, emotionally or practically. So it's just someone who's doing something for someone with myeloma. When a loved one is first diagnosed with myeloma, it brings about a whole range of emotions and feelings. Obviously, to begin with, it can be quite overwhelming. There can be fear of the unknown. There can be anxiety about the change of role that's happening. Often, for instance, the person who's been diagnosed with myeloma has been the breadwinner, and that role can be reversed. And the caring role itself can be something that can happen overnight. And it can take on many forms. So there's often a lot of anxiety, but it can also be very rewarding as well. But it takes a wee while for that reward to be felt, but it can be a rewarding experience as well. The role of caring takes on many forms, and one of the main roles is to be an information provider, an information seeker, and an information passer on. So often other members of the family will come to the carer. They perhaps don't want to bother the patient with their questions, but the carer is often a good source of information, not just about myeloma and its treatment, but about hospital appointments, but about blood results, but about common side effects and symptoms of drugs, for instance. So they have to become very knowledgeable about a whole range of things that they've perhaps never had to do before. When a patient is unwell, be that from the myeloma or as a result of side effects of treatment, the carer then does take on a more of a caring role. And that again can raise some anxieties within the family group. And often it's a case of being very vigilant and reporting side effects or symptoms very promptly. It's very important that the haematologist and the nurses at the clinic are aware of any symptoms or side effects that the patient's feeling, because often it's much better to nip these things in the bud, to catch them quickly before they become something more serious. So for instance, if a carer made it their role to check the patient's temperature on a daily basis and was aware, for instance, that anything above 38 degrees centigrade would be something that the doctors and the nurses would want to know about, that's something else that is a very, very valuable role. So the tasks that the carer may have to take on may be tasks that are new to them. As we've mentioned, there may be financial issues to deal with. There also may be practicalities such as, for instance, if the patient's blood counts are a bit on the low side, the hospital may tell you that they're very susceptible to picking up infection. And that can become a bit of an anxious time. And it's a case of, do we wrap the patient up in cotton wool, or do we allow them to get on with some normality of life without cleaning everything behind them with the Dettol, for instance. But, there is a fine balance. Keeping on top of medications. Quite often there's a whole range of medications to be taken at different times. Many carers do say that it helps to keep a diary, and they often keep a log of what's being taken, potential side effects when they're being taken. And again, it's about being vigilant and reporting things to the healthcare professionals at the clinic. It's very important that the carer has a means of getting away from the sometimes stressful situation at home. So it's important that they maintain their hobbies and their friends, and they have things to do out with being the carer, which can be a full-time role, or it can just be very, very every now and then. So it's important that they feel supported, because stress and strain can take its toll. And obviously, if the carer becomes unwell due to stress and strain, then they're doing themselves no favours, and they're not doing the patient any favours either. So it's so important that they look after their emotional and psychological needs too. Finances can be pushed at this time, especially if the patient works full-time and has had to take time off work. It can be a very difficult time financially. There is help out there though, and there may well be benefits that you're entitled to. The carer may be entitled to carer's allowance, for instance. I often say that when anybody has any questions about finances, one of the best people to speak to is someone from the social work department at the hospital. So do ask for an appointment with the social work team at the hospital. The Citizens Advice Bureau, again, is a very good resource for knowing what you're entitled to financially. You may be surprised, there may be something that you're certainly entitled to, but do ask about that. There are other resources out with Myeloma UK that carers can access. There is an organisation called Carers UK, which has lots of useful information from financial help to easing the burden if the caring is becoming a stressful situation. So please do ask for the Carers Info Guide from Myeloma UK. There is a long list of other resources at the back of that booklet, and we'd be happy to send you one out. Myeloma UK supports carers in many different ways. We have an info guide specifically for carers, which looks into their needs specifically and covers practicalities of the day-to-day living with myeloma and what that might entail for the carer. The discussion forum on our website, again, is contributed to by many carers. And again, support groups up and down the UK often welcome carers into those groups.